Hi everyone, my name is Marnie. I'm 43 years old and I live on the Gold Coast in Queensland, Australia. And I just wanted to talk about our TAPS journey from the beginning of us getting pregnant to the birth, basically. So how it all started is my husband and I had been trying for a family for about 7 years, and we were finally able to do IVF last year. In 2022, and we got pregnant on the first round, and initially we thought it was just one baby. So we had 2 scans in our obstetrician's office just to make sure that the baby was viable. So she picked up 1 baby and 1 heartbeat and ensured that it was viable and we could do all our blood tests and things like that. From there, we finally went for, a professional scan at 13 weeks gestation, and that was after our NIP test. So we walked into that scan thinking that we were going to be looking at 1 baby. And when we were there, the sonographer told us that there was 2 babies, and it was very shocking to us, obviously, at that time. We thought that the sonographer was joking. So after that scan, we got a call from the professor that runs the ultrasound clinic just to discuss all the complications that could happen from a shared placenta pregnancy. And he went through kind of twin-to-twin transfusion syndrome and a few other things, but the overriding message and what he said to us was that you'll most likely get to 37 weeks gestation and give birth to 2 perfectly healthy babies. So we kind of took that message, and the scans were all good, so we had no other reason to be concerned. So from there, he sent us a recommendation paper, so the official Australian recommendations for management of monochorionic pregnancies or shared placenta pregnancies. And one of them was to have fortnightly scans from 16 weeks. Now, the disappointing thing is that this particular clinic, even though they sent us this paper and those recommendations, didn't actually do that with us. So we had a scan at 13 weeks, then we had one at 16 weeks, and then we had one at 20 weeks. By the way, they were all fine. From there, we were referred to the public hospital, and it took a couple of weeks for the referral to go through. So we had our 20-week morphology scan by the time that first appointment at the hospital rolled around. So we walked into our appointment with maternal fetal medicine at the hospital at 22 weeks gestation, thinking that it would be like all the other scans, that the babies would be perfectly healthy and nothing was wrong. So the scan took about an hour and a half there, and the sonographer gave no indication that anything was wrong. The only indicator that we had that something might be amiss is that it just took so long, and especially when she left to go get a doctor, she said she would be right back, and the doctor took another half an hour to come and see us. And so the doctor came in and said to us, this is what could happen in a twin pregnancy or shared placenta pregnancy. And he also went through, twin-to-twin transfusion, growth restriction, and then he said there's also TAPS or Twin Anemia Polycythemia Sequence, and the results of the scan today show that your babies have this. I instantly blamed myself upon hearing that diagnosis, thinking that it was something that I had done. So either my age, my weight, something like that, that I had done to cause this. From there, we had several other scans before they confirmed the diagnosis for sure. So that's standard in suspected TAPS cases. They always scan multiple times. And so once it was confirmed, from there we were put on something called expectant management. So this was just a wait and see approach. And everything was going fine up until 28 weeks. So the TAPS was stable, the babies were stable. They were always reassuringly active during the scans. It was actually quite fun to see. And I guess the benefit of having weekly scans is that you get to see your babies all the time, right? And they were just so much fun to watch. So at 28 weeks, unfortunately, the TAPS had progressed, and that means there was, I guess, a higher difference in the blood flows between the babies, but also our donor baby, so our anemic baby, was showing signs of an enlarged heart, and our recipient baby, or our polycythemic baby, was showing liver changes. So from there we were referred to the Mater Hospital in Brisbane, and those guys are world leaders in fetal therapies. So we went up to see them and get a scan and see what they thought we should do. So the recommendation from them was to do an in utero transfusion. Now, this was obviously a very scary decision to have to make, but we believed that it was going to be the best chance to guess buy time in the womb. We could have delivered them at 28 weeks, but then there's, the prematurity factor. So I was a good candidate for in utero transfusions because I had an anterior placenta, so it was right in the front. And they could access the baby's umbilical cords very easily through there. So we drove back up a couple of days later to have the first of 2 in utero transfusions that we would have. And in short, the first in utero transfusion went really well. And I was released within a couple of days. I actually started contracting, so they actually had me stay an extra night, but everything was fine. So I went home, and for the next 3 scans, everything was fine. And we got to 32 weeks, and my hospital, my MFM department, decided that it was time to deliver at 32 weeks. And that's because the numbers had changed again, so they were kind of going back to where they had been previously at 28 weeks. So I was admitted, and then I had a doctor promptly tell me, unfortunately, we don't have NICU or special care beds for your babies, so we're going to have to send you back to the Mater, and they will decide what to do with you. So we drove up the next day to the Mater, and the Mater decided that, again, the best course of action was to do another in utero transfusion. Basically, it was explained to me that it would actually be easier for the whole team there if they just delivered the babies, and it's kind of out of their hands. But what they were looking for was long-term outcomes. So I was still a good candidate for the in utero transfusions because they'd done it before. They knew my body, they knew my babies. So let's try it and see. So where the previous one was done in ultrasound room under local anesthetic, so I was awake and felt everything, the next one at 32 weeks was done in theatre with an epidural. And the reason for that was the doctor could change to a cesarean section if the babies became distressed. There was higher risks because of the later gestation at 32 weeks and doing any kind of fetal therapy on twins. So thankfully everything went really well. And then from there I was sent home and basically told it could be any day now. So even if we've bought a day, that's another day in the womb that they have to grow. And so I went home, everything was good for a week. I had a scan in between, so I had another scan at my home hospital. Everything was fine, and that was on the Wednesday. And then on the Saturday my waters broke, and I went to hospital. Again, I was admitted, and they started antibiotics and things. And then about 3 days into my hospital stay, because I had no other signs of preterm labour, the way that they treat this is to just give you antibiotics, and say kind of rest up, and we'll deliver, or we'll decide when to deliver you. And I had a doctor actually book in a C-section, but it was with a regular doctor, not an MFM doctor, which I raised concern about. So when I raised concern about this, the doctors had a discussion, and actually discovered that there were no NICU or special care beds again for me. So they shipped me off to the Mater immediately. So I was told to fast in case they wanted to deliver the babies then and there as soon as I got to the Mater. And that was about an hour away from my home hospital. So when I got there, I hadn't eaten in about 12 hours. It was horrendous with a twin pregnancy. And they called the doctor involved in my case, and they said, no, we're going to wait to 34 weeks. And so that's what we did. By this stage, I was only 2 days off 34 weeks. And the next day, I went and had a scan in maternal fetal medicine just to check the baby's well-being. And we found out that only one of the twins' water had broken, and that was the polycythemic or recipient twin. Her water had broken, and they decided that it was most likely as a result of the second in utero transfusion. So with all that, they sent me back up to my room. I ate really well, and then I had a routine CTG. And it was discovered on that CTG that the baby, our recipient baby, or the one whose water had broke, was in distress all of a sudden. So only a couple of hours previously she was completely fine, and now she was in distress. So we had to deliver the babies then and there. Unfortunately, my husband was at home an hour away because we thought we were actually delivering the next day. So unfortunately, our babies couldn't wait 12 more hours. They had to be delivered then and there. So within a half an hour, we had delivered the babies, and they actually did really well coming out. We did discover later that that recipient baby, or my twin one, who was the firstborn now, she had actually got an E. coli infection. So there's a couple of theories as to how that happened, but the main theory is that after the second in utero transfusion, my water broke, infection got in, went to my placenta, and my recipient baby, or my twin one, got that infection. Twin 2, or our donor twin, did not get that infection at all. So our poor recipient baby did not only have a thicker blood floating around in her system, she also had to deal with an infection, an E. coli infection. Unfortunately, they couldn't confirm the presence of meningitis, so that she actually had to have a long line for 3 weeks. So she was on antibiotics for the first 3 weeks of her life. Thankfully, both babies were really, really stable. So my girls were just amazing. They kicked goals in hospital, and we were in NICU for 10 days, and then we were in special care for a further 16 days. So it was 27 days all up that the girls were in hospital. And now they're home and they're really healthy. The only thing that we have left over from the TAPS is that our donor twin actually has a permanent hearing loss. So that's something that I can talk about later. Thanks for watching, everyone. I just want to mention that video was actually recorded back in November when I had a few moments to myself to tell my story, and I just really wanted to get it out there while it was fresh in my mind. I do have big plans for this channel, and I will be breaking down quite a few elements of my pregnancy and birth story. So everything from my grief in pregnancy, so losing my mum, right through to what is an in utero transfusion and what that looked like, and our birth story. The next video will actually be on our TAPS diagnosis and what that looked like. So I hope you will stick around and watch that one. If you do have any questions, please pop them below or reach out to me on my other social media channels, and I hope to see you at the next video.